guys, welcome back to my channel. My name is Sarah Wild. I'm a certified registered nurse anesthetist. If you are here, if you clicked on this video, you are probably in some way interested in anesthesia. You're either in anesthesia school, you are possibly getting into anesthesia school, or you just want to know more about it and what it's like. I have a lot of really awesome resources kind of understanding what is anesthesia. This video, I talk about the fears of anesthesia, and then I just like to give a lot of tips to people that are currently in school, just about like possibly how to get a job when you get out of anesthesia school or getting close to the end. So don't forget to go check out my other videos. And if you guys like what you see today, please subscribe to this channel, like this video, and head over to my Instagram. I do a lot of like daily lifestyle content, daily work routines, and just my personal life. It's super fun and I love chatting with you guys. It is my goal just to be a resource and just to be encouraging to any of you out there that are pursuing a career in anesthesia. It has been extremely fulfilling for me to get through school and to start working. So just for a little background for me, I went to Barry University based out of Miami, Florida. I went to the Tampa campus. It was a rigorous program. It was extremely hard in my opinion, a little old school, but it prepared me super well. The clinicals were cutthroat at times, you know. There were some very discouraging times in clinicals, but at the end of the day, we're there to provide anesthesia, which anesthesia is no joke. You know, we have people's lives in our hands. We have to be on the top of our game. We have to be extremely well, responding appropriately in really hard times. So that's why not only is it really hard to get into anesthesia school, but they make it a tough process. So having said that, I am gonna do a two-part series to kind of help you guys get through anesthesia school. And I have two different things I want to talk about. First of all, I want to talk about just clinical tips on how to succeed, how to maybe take a little bit of pressure, prepare well up front. I think the first 2 months of clinicals are make or break it. It is extremely stressful. You get there, you're so overwhelmed. You have no idea really what's going on. I'll never forget, like, I'm sitting in the OR and I'm like, I don't think they understand how much I really have no idea what's going on. But I was like, fake it till you make it. Like, I'm only going to learn by doing and seeing, you know? So you have to have confidence and you have to be a good learner and just really absorb it. So we're gonna be talking about, for the first part, clinical tips and how to succeed. And then I also just wanna do a quick video on just some study tips for the didactic part. I just thought I'd give you guys my tips and things that help me, and hopefully maybe it'll help one or two of you. But for today, we're gonna do clinical tips. So let's dive in. So how do you study morning, afternoon, evening, give up your personal life, excel clinically, and still not have a mental breakdown? That is a good question, and I can honestly say probably all of us in school at one point went through a very discouraging time. You know, for me, it was at the end of my third semester full-time. I was a front-loaded program, so I started clinicals just like the second month in school. So I was learning so much. I got thrown into clinicals, and it was just so overwhelming. And I am very much of like an adrenaline junkie a little bit. I love the challenge. I love to work hard. But after that third, like a year into it full time, like I was worn down. I was probably clinically depressed. I was I had no personal life. I had no going out with friends, you know. Thankfully, I had a very good home life with my husband, and he was super supportive, which totally just saved me mentally. But I remember at one point telling him I could quit and not even care. Like, and that is so not me. I'm like one of the most determined people I know. Like, just nothing will get me or stop me. And it's very sobering thinking about it. And it just really just a testament to how anesthesia school is not a sprint. It is not a just get through, and you know, it is a long marathon, and you have to put things in place that are going to help you succeed physically, mentally, emotionally, spiritually, all those things. Today, I want to give you guys some tips on how to do well clinically. Part 2 of this video will be some tips, just some studying tips and just some personal habits with studying that hopefully will help you. So let's dive in. My tip number 1 is going to be download Quizlet before you start clinicals. And if you've already started clinicals, it's never too late to learn. Download Quizlet and create different sets of cards to quiz yourself. So, and this was someone else previous that had already graduated, a Srna, told me to do this, and it was super helpful. So I created a set of induction drugs. I created a set of emergency drugs. I created a set on the anesthesia machine, and I also created a set on airway anatomy and management. Now, those were all just, to me, like in my opinion, are very, just kind of the building blocks and basics of clinicals. You know, those are the things you'll probably get pimped the most on. You'll get asked questions the most on. Now, sometimes you'll get random other questions, but those are things to me as a new CRNA were important to know. Every morning, you know, at 4 a.m. when I was getting ready for the day, or if I was eating my breakfast, or if I was at a stoplight, I'd pull out my Quizlet and I would just run through cards. You know, propofol, what is the induction dose? What is the side effects? What is the mechanism of action? You know, I just wanted to know these real quick basic truths about each important thing. Now, it is so much information. So I remember I'd be flipping through these and I'd be like, how am I supposed to remember all of this? This is so much. Guys, that's what I'm telling you. Quizlet was super helpful to me, because it was just like going through it over and over and over and over and just pounding that information in my brain. So that was super helpful to me. Okay, step number 2, show up to your clinicals early. And when I say early, first couple days at a clinicals, you should be there too early. Get there too early, familiarize yourself with the facility, where your equipment is, and kind of figure out like what time do the CRNAs get there. You want to make sure before your CRNA gets there, you have set up your room as much as possible. You have looked up your patient, their health history and everything involved, and you have looked up your cases that you're doing and just have a basic knowledge. You know, for me, when I first started, if my case was at 7:30, me and my classmates, we were there by 5:30. And that was just like the first couple weeks to get familiarized, because we knew nothing. We were so brand new. So we got there so early. Now you do have to be careful. You know, some places you have Pedi Crisis, some places you don't. So at least draw up your syringes. If you want to label them, you can. Do your machine check. They're going to ask you, did you check your oxygen cylinders? They're going to ask you a lot of maybe silly questions, in my opinion, as a CRNA now. But they're going to ask you that. There's always CRNAs and docs that love to pimp you as a student. Set up your machine, set up your airway and everything you think you'll use. Here's the thing, you're going to be wrong, because not only do you not know that first couple weeks, the first month of clinicals, exactly what you're gonna need, every single CRNA will be different in what they want. Every time. You know, like you'll have one CRNA that says, why are you using a hard bite block? Don't you know that it can cause necrosis to the tongue? Always use a soft bite block. And you're like, oh, okay. You know, you make your soft bite block for the next day. And what does that CRNA say? Why did you do this? That is such a waste of resources. They literally make us bite blocks for this. This is what you use. And you're like, and like your first reaction is to be like, bro, chill out. Like literally someone just told me to do this. But you cannot say that. You cannot say that. So you have to realize everybody has a different setup, what they want. Hopefully your CRNAs will be gracious. And I would just encourage you, if you can find some way when you introduce yourself to CRNA, hey, I'm so-and-so, I'm from this school. Thank you so much for letting me be with you. You know, I've done my best to set up for this case. And then you can say, hey, just so you know, this is my first week, so I'm trying to learn everything. And I'm trying to do my best to learn. But you'll have to let me know how you like it specifically. That's just kind of your way of saying, hey, I really don't know what I'm doing, but I'm trying hard. I want to be a learner, and I'm here to learn. So I just encourage you, get there early and set up as much as possible. Okay, tip number 3, and I kind of touched on this in my last tip, is be a learner. Guys, we are all not only nurses, by the time we get into anesthesia school, but we're ICU nurses. We're used to managing sick patients. We're used to multitasking. You know, we're used to like really extreme situations. A lot of us were charge nurses. A lot of us were on code teams. A lot of us dealt with, you know, pretty intense situations. So it's kind of hard to get back into school and kind of be treated, be treated like a student and kind of be in that position of feeling dumb, but work really hard to be a learner. Work really hard just to keep your mouth shut when someone tells you to do something exactly opposite of your preceptor the day before, and you say, oh, I'm really sorry. Thank you for teaching that. I will, I really appreciate you taking the time to teach me that. Just that idea of like, they do it their way and you are there to learn from them. So don't argue with them. Don't talk back. Just say, thank you so much. I really appreciate it. And here's the thing, and I really encourage you guys, if you are pimped on something and you don't know, don't say, I don't know, and leave it at that. What you need to say is, hey, I can't recall that. Do you mind if I look that up later, study it, and I can get back to you? And that just kind of shows that you don't know, and they know you don't know everything, but the fact that you're a learner, you're there to learn, and you're willing to put in the work. That's gonna go a long way. It just shows, hey, I don't know, but I wanna learn, and I'm gonna go look it up and study it. So that someone told me to do that, and I am like I had a hard time with that sometimes, because, I'll never forget one time I was doing a spinal, and I was with this doctor actually who gave me this like really awesome like physiology education on spinals, and it like just really made sense to me. And and he didn't pimp me at all. He actually honestly just taught me, and I thought it was really kind of him. And then the next day I was with the Srna. Let's just say she has been practicing for a long time, so she's very stuck in her ways, and she started quizzing me on spinals, and I was actually like super excited about what I just learned. I'm like, well, and I kind of started talking through the physiology of what I just learned, and she looked at me and she's like, your school, like, what are they even teaching you? That is completely wrong. And she proceeded to tear me down. Like, I was literally just sitting there like, and I'm not gonna lie, that time I was like, I am so sorry. I'm gonna have to go read on this. Dr. So-and-so was actually the one who told me all of that, but I really respect your opinion, and I'm gonna have to go home and study this more. And she kind of like, and her face kind of changed, and she was like, oh, so, so you'll realize when you get into school, some people make mistakes, and maybe they were taught different ways, and they don't always agree on some things. So you are there to learn. You don't have to take everyone's advice, and you don't have to take their method for doing things, but you're still with them, and you still have to be respectful. So that can be hard sometimes, especially when people are inconsistent. But be a learner, keep your head down, smile, be agreeable. You can do it. All right, tip number 4. And this tip, I hope you guys, it's really helpful to you. I want to show you guys my favorite resources during school. And honestly, some of them I still reference today. They're super helpful. So my number 1 resource that I used every single day in clinicals, every single case, honestly, was Vargo. Now, I love Vargo. My school actually encouraged us to look this up, which I think is awesome. So kudos to Barry for promoting Vargo, because it's a great resource. Written by a Srna, and I love it that they use a lot of actual textbook resources to back up everything that they say, but it's all very clinically helpful. So first of all, I'm going to pull up Vargo here on my screen. I would say, first of all, my first tip for this app would be to use it to look up your cases. Here you can type in the case or go, it's alphabetically ordered. You can find your case, you can open it up, and then you can see all of the tips recommended. They have the type of anesthesia often used, because when you first start, guys, you're not going to know exactly, can this be done under mat? Can this be done without paralytic? We don't know. So this will tell you generally what is used. This will tell you common side effects, any special hemodynamic changes. I remember when I first did shunts, this app was super helpful. It gave you tips like, hey, just so you know, when you start seeing this, you need to give a propofol bolus because it's super stimulating. You know, just little like pearls like that help you not look really foolish, because your preceptors are going to kind of let you fly and see if you've done your research, you've done your homework. So that part of the app was super helpful. Another part that I really liked that helped me a lot when I did my OB rotation was the OB section. So OB is incredible. I do OB in my practice now. I do epidurals, you know, I treat all sorts of different things, but you can have some pretty extreme situations and you have to be able to respond fast. So I loved, honestly, I would just read through that OB section because it had a lot of really pertinent things to know. But also for epidurals, guys, if you're new at epidurals, open up the OB section in Vargo. It gives you breakdown of the anatomy, it gives you tips, it gives you clinical step-by-step. It talks about different emergency situations. Super, super helpful. Another area that I used quite often was you click on the adult anesthesia part and you put in their weight, and it gives you all of the tips you need to know for like fluid regulation and like medications as well, induction doses if you want to go through everything. And then one other section I really liked, I use this a lot, was the crisis section. Now, when you get to a crisis, when you have sudden bradycardia, you're not gonna have time to pull open your app and like read during the situation. So I would encourage you actually read through this and all of the downtime you guys have. But maybe at lunch and at clinicals, or there's a time where you just have a few seconds, read through, make yourself familiar with those crises. Now you'll probably read about some of this in your textbook, but it helped me to have it on the app, just like a condensed format version of just be like, okay, if this happens, I'm gonna do this. If this happens, I'm gonna do this. So super helpful. I love Vargo. Go follow Vargo on Instagram. They just give a lot of tips daily. It's been a super encouraging and helpful resource for me. And not too long ago, they actually came out with their sister app. It is a completely different app. Their sister app, is really cool. You open it up, it's got a search engine, and you can click on the different categories for the type of cases, just honestly a more in-depth physiology of what's going on or what you're dealing with. So that's also great. I have both of those apps, and if you go on their Instagram and message them, they'll actually give you a 28-day free trial if you just want to familiarize yourself with the app and see if it is for you. Definitely would encourage the Mega app. That was like my go-to resource for everything. It's super awesome. Okay, my next resource that I absolutely loved during anesthesia school were my regional anesthesia apps. So there are a few different ones. When I was in school, Buddy Block actually had a free version. I don't think they have a free version anymore. Like, my app has just been acting funny. I think you actually have to pay for that. Another free option is Srna. Srna, they have videos, they have, bring you step through step the anatomy, what we use it for. So these are great resources. You can also buy the advanced version of Buddy Block, and then I know a lot of my coworkers use Block Jocks, but I just looked it up in the App Store and it's like stopped working. So I don't know about that one. A couple more resources that may be super helpful to you. I remember I had a hard time in school with pacemakers and ICDs. I had a hard time, like in pre-op, if they had a pacemaker, I'm like, crap, like, how do I know? Like, I just felt very, like, you can read about it in a textbook, but clinically, I just had a hard time knowing, like, okay, what's the type? What do I really need to know? Like, what are things that I never felt, which it's on me, but I never felt super comfortable enough to ask good questions of my preceptors. I felt like they all just kind of felt like I should know everything about it. So look up this app called Magnet Master. You literally put in the manufacturer. You can ask the patient, what's the manufacturer? So you can look up the manufacturer, and then you can look up if it's a pacemaker or a combo, and then it literally gives you everything you need to know for that case. What you need to worry about. Do you put a magnet on it or not? Like, double check to see if the surgeon's using bipolar versus monopolar. Like, just important things to know. So I encourage you guys to get that one. It helped me a lot. Two more resources that I found were really helpful. Another area that I kind of was I could never remember everything was all of like things to know about if patients were on blood thinners. Like, okay, how long do they need to be off this blood thinner versus this one? Is it okay to do an epidural if they've been on this? How long does it, need to be, or when do they need to stop it before I can do this? So look up the app, ASRA Coags, and it gives you everything you need to know. It tells you when to stop it, when you can poke a patient, all the information you need to know. It's a wealth of information for specifically blood thinners. Last but not least, another resource I really like, pediatrics is like a whole different world. Not only do you have different doses for everything, use different equipment, which Vargo does have a whole pediatric section. So you can put in their weight and it'll tell you what oral airway size, what ET tube, drug dose and all that stuff. But I really loved this app called Pedi Crisis, specifically for pediatrics. And at Pedi Crisis, you go through all the different types of crisis and it talks about things you need to know, medications you need to have available, all the things. So a lot of times in pediatrics, you can kind of think through a lot of the common effects of that type of surgery and go through and read through those crises and make sure you're aware of how to respond and react. Obviously, like I said, when that event happens, you're not gonna be able to look it up and read about it. But you can often say, okay, this patient has this syndrome or this issue, which is often associated with seizures or bradycardia or laryngospasms. Go look up those situations in the Pedi Crisis app and prepare yourself. Have a plan in place. So those were my 4 tips, and I actually have just a couple small pearls to just add to those tips, just to kind of encourage you as you go through your clinical experience. The first pearl is carry a little notebook. I would just use I would carry a little notebook like this. I would keep it in my pocket or in my jacket pocket, and I would put my date down and I'd put what case I did, and then I would jot down any specific things I needed to go study or make sure I knew about that case. And then if I were to do blocks or epidurals or spinals, specific things that you can document in Typhon or wherever you document your case counts, I would jot that down too, because I oftentimes just got busy throughout the week and forgot to document every single day or put in my numbers every single day. So that helped me go back and know what exactly I did. And then one more just little clinical pearl. I would just say okay, so you don't need a lot for clinicals. This literally is all I would bring. Like I said too, this is all I would bring to clinicals. I bring my stethoscope, I bring my badge, and then I would bring a couple pens and then my notebook. And if you were studying a specific thing for class and you didn't have Quizlet or anything online, my first couple semesters I did do these. I did do 3x5 cards and just quiz myself. So maybe I would keep that if I had a test coming up. But you really don't need a lot for clinicals. I've seen some other people's just their advice on what to bring to clinicals, and they had this big long list of everything they brought. And for me, it was just pretty simple, just a couple things. Did not bring textbook to clinicals. It was just, you don't have time for that, honestly. You just keep it simple, get there, set up, be a learner, download your apps that'll help you be your resources when you're on the toilet, when you're going to the bathroom, when you have just a couple minutes, look those up and learn. Another pearl is be a hustler. Guys, I cannot tell you how important it is to manage your own education. This is your career. You are learning right now for your career, and you are going to be a product of your decisions. You are going to get out of your education what you put into it. So if you're someone that gets there late, leaves early, your education is going to be subpar. Doesn't mean you can't be a good clinician later on, a good practitioner, but if you want to do regional anesthesia, if you want to do epidurals, if you want to do spinals, if you want to do wake intubations, if you want to be, very skilled in certain things, you have to hustle for those things and you have to speak up. I remember one clinical site, they kind of laugh at me and tell me I was kind of a little savage because I love regional. I wanted to do regional, and I knew that in school, but I saw so many of my classmates just didn't have any regional experience because they were hard to get. A lot of you know, the anesthesiologists for some reason did not love CRNAs doing blocks. So it was kind of like their way of keeping CRNAs from progressing. And so the few clinical sites is like, I wanted to do them all. I wanted to do as many as I could. So I remember I would get there early. I would pre-op all the docs' patients for him. And I'd say, hey, do me a favor, like, if you have any blocks, give me a call, text me. And because I would get there early and I would hustle for them and I would do their pre-ops, guess what? I would be in the OR and they would text me and they'd say, hey, I've got a block, you wanna come do it? And they would actually give me other students' blocks, which totally pissed them off. And I remember other students would complain about me, but I didn't care because at the end of the day, it was my education and I wanted to learn as much as I could. So all that to say, you still need to manage your own cases. You still need to get there early, pick your own case, make sure you're doing everything you're supposed to. But you know, if you go above and beyond, you are gonna get more out of your education. So those are all of my tips today for clinicals. I'm curious if you're a CRNA or if you've already been through anesthesia school, and I'm curious if your experience was similar to mine, if it was different, or what are some other maybe tips you would have to give to students. And if you're a student, comment below. Let me know if any of these tips helped you, or maybe you have had some tips that helped you that were different than mine, and that we can help other students be the best students they can. At the end of the day, guys, we all want to be done with school. We all want to practice. We all want to be CRNAs. So good luck to you guys. Good for you for hustling. You are in the top 1%. You know, you guys are getting up before everyone. You're going to bed before everyone, and you're working harder than everyone. So kudos to you. I'm super just impressed that you're even here, and keep hustling, because at the end of the day, we are products of our decisions, and you are going to be a CRNA. You are going to be making 6 figures, and you're going to be enjoying life. So cheers to you guys. Continue to be a hard worker, be a learner. Don't stop hustling, and I will see you guys on the other side. Cheers.